Hello, it's Chloe Bruce, the gas journalist again. I've talked in previous videos about my diagnosis of schizophrenia a long while back and what it feels like to try and live and work in Britain and abroad even with this condition. I'm here today now, just want to talk briefly about what it's like to be admitted to hospital for the first time. And I've actually had 4 hospital stays in total when it comes to psychiatric care. I've been admitted to psychiatric ward 4 times, twice voluntarily and twice under section. And I've talked in a previous video about my first psychotic episode. And now I want to just say what it's like in the build-up to going into hospital with the psychotic situation and my build-up to the diagnosis of schizophrenia. So I have talked in my previous videos about how I was diagnosed with schizophrenia in my late 20s. I have described my first psychotic episode and how my fear became so great I felt I had no choice but to admit myself to a psychiatric ward. Not only did I start to hear voices, but I was also terrified of being poisoned. If I drank water, I would actually just get more thirsty. I would get terrified of the phone because when I answered I could hear strange sounds and then they would hang up. I heard the sound, for example, of my father panting and then a gun shooting him as though there was a silencer on the gun. I also started to get delusions of grandeur. I thought I was some kind of very important spy, and it is the very important here that is the wrong thinking. The whole thing, of course, is wrong, but just to think you're very important is the delusion of grandeur, is what I mean. Anyone can speculate, think, well, I wonder if I'm some kind of unwitting party to espionage. Anyway, but actually, as it so happens, I was super organised and would pack my bag before going out perfectly. And just as I made my decision to go into hospital, I packed my phone, my dictaphone, pens to write with, and various other items I would need. I had not been neglecting to wash, but my hair was a bit greasy because I thought there's poison in my shampoo. I'd also taken up nicotine smoking, that is cigarettes. This is a known phenomenon when on antipsychotics, as some people smoke to offset the side effects, and this was the case for me. That said, I would only be taking at this point my antipsychotic medication intermittently, as I was frightened it was poison. Looking back, some of the strange feelings I had may have been the consequence of epileptic fits, and I've discussed this in previous videos. I was diagnosed with epilepsy a few years after this diagnosis of schizophrenia. Despite this abject terror, I had a deep sense that it was somehow all for the greater good, but this fed into my idea of this spy. My mother drove me to Queen Mary Psychiatric Hospital in Roehampton, and I was admitted to what back then was called Vine Ward. It had both male and female patients, and the male and female beds were in separate corridors, but the ward was otherwise shared. Each patient had a bedroom to themselves, and there was a curtain instead of a door at the entrance of each room. There was a smoking room, a TV room, and a small garden. It was coming up to Easter, and I started to have strong spiritual and religious experiences, for example, a strong attachment to the Virgin Mary. But these were good moments. In other moments, I was petrified. For example, I thought my cigarettes were laced with poisons. I thought the first drag would give me heart problems, and this was because I had a very abnormal heartbeat at that point. But I thought that it was the second drag that would kill me, just some kind of bizarre poison that behaved like that. I was losing a lot of weight because I was so frightened about poisons in my food I didn't eat, or at least much. I'd have a few bites of a sandwich that was brought in for me. But the worst pain I had in hospital was the pain of hunger. I remember lying in bed just thinking I've never known pain like this. The second worst experience in hospital was when I was trying to close my eyes to sleep, but my eyes would not close at all. They would just sort of stay open. I couldn't even blink. And this went on for minutes and minutes and minutes. I thought it was the CIA's fault, but then I heard a booming male voice say, the CIA is ruthless, but not that ruthless. Back then, all my voices were male. Also, events would repeat themselves as I was on some kind of psychotropic drug. For example, a staff member poked their head around the curtain of my room and said, lunch is ready. And the exact same event happened again a little while later. The majority of staff did not seem to care at all about any of the patients. For example, they were not very kind about my fear and would just shout at me, and I heard them also shout at other patients. They also did not bother addressing my lack of food and water. Once, when I plucked up courage to go into the ward canteen, I asked what was vegetarian. I had been a vegetarian since the age of 4, and for moral reasons. But this particular male staff member, who was also a nurse, pointed to a kind of bulgweed and said frog's eyes. I took it literally and thought I was literally looking at actual frog's eyes. I started to scream and didn't eat as a result. As I was screaming, this man, this nurse, just laughed and laughed, and sometimes they would just laugh at our pain and terror. To summarise, the ward staff were the most callous, unpleasant fiend to any kind of recovery from the patients. I remember a relative gave me a t-shirt, and on the front of this t-shirt was a kind of tourist t-shirt that said the Caribbean on the front. And a female nurse had just started to have a go at me about it, saying, "You're just wearing that for show." You have to understand the staff behaviour in the context of how distressed the patients are. I mean, in the context of how distressed we were, the behaviour was horrific. I will never forget being handed a piece of paper by staff that said I was a danger to myself and others. I cannot describe my feelings at that stigma, how I couldn't understand how they could possibly think I could harm anyone. Even some of the patients were saying to me, "You're one of the kindest, nicest people we've ever met." I had the audio of one psychiatrist saying to me, "Do you feel violent at all?" This is an insulting question. There was never any, he didn't say there had been allegations or anything like that. He just decided to ask me this painful question. I said I wouldn't hurt a fly, which is quite true. I'm someone who just spent ages trying to rescue spiders from baths or getting insects out of their home. A lot of my nurture as a child came from the cats we had. Sometimes we had as many as 7 at a time. They were like parents to me. I cannot even describe how much I loved them. One cat was my rock when I was psychotic and about to go into hospital on this occasion. He would bite my chin and then get me to follow him and coax me into drinking water by pointing his nose towards his own water bowl. And I actually think he saved my life because of him doing this on a few occasions. I think I was able to drink a little tap water because I wanted to please him. We also had a dog when I was a child, and I was the one who'd walk her the most. I would love sitting in the garden with her, and I remember how kind she was to one of my cats. This particular cat had a stillborn kitten on one occasion, and the dog whimpered when she saw this cat in sorrow for her loss. This cat later went on to have 6 kittens, and they all lived, but they were born with cat flu. I would put specialist cream from the vet into their eyes each day and saved their eyesight. Just one of them had one blind eye, but the other one of his eyes was very good, so as such he could live on in a good condition. I cannot even describe to you how much I love animals, and it's not that I don't love people also. I have always had immense love and affection for my friends. I'm about to get onto the worst bit of the ward. There are so many examples of callous, cruel behaviour from the staff and inappropriate behaviour that it's probably too much to say right here. But I want to say something. I cannot say this ward was safe. Fistfights would break out, fire alarms would go off, and there was cigarette smoke all over the place, and some of the men would be sexual with the women. Now, remember that we have probably all got this piece of paper saying we're a danger to ourselves and others. Yet the staff allowed children onto the ward to visit, even though we were supposed to be so dangerous. And maybe in some cases there were genuine dangers on the ward. And they would let even tiny babies and young children on the ward. And I know for a fact some of them came to harm. And it is one of the most painful experiences I can ever describe because I was too vulnerable to tell until now. And I know the fact is that staff couldn't possibly have cared, otherwise they'd never let it happen. And these children weren't just on the ward in a supervised sense, they were literally just on the main part of the ward with all these distressed patients milling around. To say that these children must have been petrified when even the staff themselves by their own admission can't cope is an understatement. I leave it to God to forgive them because I cannot. It is the sheer hypocrisy of staff telling us on the one hand how dangerous we all are and stigmatising us in that regard, and then not caring at all about these visiting children. This was my first stay in hospital. I've had, as I said earlier, 3 further admissions, 2 by section and 1 voluntary. I can say there is no improvement on the staffing level. On the contrary, the standards of staffing just get worse and worse. I'll talk about this and my second stay in Queen Mary's, which was 10 years later, in a future video. Thank you.